Buenos dias, Zamboanga. Welcome sa Kapihan na Zamboanga kung saan pag-uusapan natin ang pinakabagong COVID-19 update sa buong rehiyon. We are live at PA Western Mindanao Facebook page, One TV Philippines, and other partner agencies' Facebook pages, and via cable televisions at MCTV at eMedia. Ating kukumustahin po muli ang sitwasyon ng ating COVID-19 cases and of course ng ating vaccination campaign sa buong rehiyon. Kasama po natin from Department of Health, we have a Doc Jemuel Cristobal. Welcome, Doc.
Thank you, Ma'am Myra, and pleasant afternoon to all of the viewers. I may proceed to present the national and regional data for COVID-19.
Okay, go ahead, Doc.
So for the national data as of February 21, we have active cases at 58,657. Recoveries are at 3,539,106. with 55,763 deaths, with a total case count of 3,653,526. For the regional case bulletin, as of February 20, we have 840 active cases with 56,256 recoveries and 2,437 deaths. Total case count is at 59,533. And for the breakdown of this total number per city and province under Region 9, so let's look at Zamboanga City with active cases at 495 and recoveries at 26,000 plus, 1,084 deaths, and total cases at 27,928. And we see the breakdown granularly per province and city. For the next slide, we have the total number of specimens for RT-PCR swabbing for the day of February 20. We were able to gather 262 RT-PCR swabbing for RT-PCR. And this shows us the total number as of that day, 262 swabs conducted with a positivity rating of 11.83%. This shows us the regional temporary treatment and monitoring facilities, bed capacity, and utilization rate. So for the whole of Region 9, we are at 2.88% occupancy rating, which is low. And the highest as of now is Isabela City with 23.6% occupancy, followed by Zamboanga at 13.6%. This shows us the healthcare system's capacity, which is a combination of the different isolation beds, COVID ICU beds, and mechanical ventilators used in the hospital setting. So for the whole of Region 9, all total number of beds, ICU, ward, and mechanical ventilators are at low risk utilization rate. And all other provinces fall either under minimal to low risk occupancy rate. And finally, we would like to just remind our viewers about the vaccination rollout, specifically to avail of the booster shots that are made available. And we have in the next slide a breakdown as to the different brands and when they can get their shots. Next slide, please. So here we see on the left part of the table the primary vaccinations or the different vaccine brands available. And all of them should have a minimum interval from the last dose of 3 months until they can get their booster shot, except for Janssen. So all 3 months at least after their second dose or the final dose, and Janssen at least 2 months. So we can choose to choose either homologous booster shots, which is similar to the primary vaccination chosen, or heterologous, which means a combination of different brands or vaccination types. Next slide. And finally, we come to probably a few questions that we might have. Back to you, Ma'am Myra. Thank you very much.
Thank you very much, Doc, for the update ng ating COVID-19 cases and of course sa ating vaccination rollout. Doc, speaking of our vaccination rollout, we started already our pediatric vaccination for ages 5 to 11. How's the acceptance po ng ating mga parents and for the, yun po, sa ating mga bata?
So we have pretty good acceptance in terms of our vaccination rollout for the age group of 5 to 11. So taking, for example, the teachers and the whole of DepEd who have been very fully supportive of our efforts. And if we look at the percentage as to coverage for the pediatric age group of 5 to 11 who are with comorbidities, we were able to already cover less than 1% of the target population. But for the rest of the pediatric population under 5 to 11, we already covered between 38 to 39% for partial to full vaccination, which is a pretty good statistic. Yes po.
Thank you, Doc. That's good to hear, Doc, no? As of now, Doc, have you recorded po adverse effects from the pediatric group?
Regarding adverse events following immunization, so we have captured for the 5 to 11 age group only 2 children with adverse effects following immunization. All of them were minor. So considering that we have vaccinated probably around 500,000 already, and only 2 had an adverse event following immunization. Right? So that's a pretty good statistic, all of which were minor.
Okay. Thank you, Doc. And yun nga po sa mga nanonood ngayon na parents, no, ay wala po tayong nare-record na adverse effects. So sana po magtuloy-tuloy at sana mas ma-encourage po natin yung ating mga parents with this. Doc, are we still continuous ba yung ating vaccination for the 5 to 11 years old? Do we still have enough vaccines for them? And do we have scheduled vaccination po for this week?
Yes. So regarding our availability of vaccine, kasi we only have one specific type. The WHO. So at present, no, we do have a shortage in terms of numbers. That's why we are encouraging the local government units to really save the specific type of vaccine designated for this age group. And as we we are not sure when the next batch of vaccines would arrive for this age group. But we still do encourage the parents or the guardians to have their children registered for vaccination in the event that the next batch of vaccines would arrive.
Okay. Speaking po, Doc, sa ating registration, where can they register? We receive po mga comments and questions on this po sa ating mga Facebook pages. Kung saan po sila pwedeng makapag-register? Is it sa schools po ba natin or they can also register sa ating mga LGU?
So the vaccination rollout is turned over completely to the local government unit. So they can register either online, we call it the Zamboanga online, or they can approach anyone from the to register at the barangay health centers. No? As the barangay health centers, if with available vaccine, also allow walk-in. So do na yung registration. But other than that, it's either online or through the barangay. And they can also avail assistance from their local schools po.
Yes. I think po, no, kung enrolled po yung ating mga bata, yung ating mga anak, ay they can register or they can coordinate with their schools, yung kanilang mga teachers po. Doc, last question na lamang po. Seeing the trend of cases in Zamboanga Peninsula, can we already consider that we are at the low risk for COVID-19?
Yes, so indeed we do see significant improvements in terms of the statistics for COVID-19, both for the utilization of beds at the isolation facilities, which are for moderate to or mild COVID, and with regards to the capacity utilization for severe to critical, which is in the hospitals. So indeed, these are decreasing. And however, we should continue to keep our guards up because these statistics, they are very fragile. They can spike at any time. So our approach should be that we continue to keep our guards up, continue to wear face masks and social distancing, and of course, to our priority is to continue to vaccinate as many as possible in order to get to herd immunity.
Okay. Thank you very much, Doc. Doc, do we have a message or words of encouragement po no, to invite everyone to get their booster vaccination and of course sa ating pediatric group din po?
Yes, thank you very much, Ma'am Myra. No, thank you for having me, and it's been a pleasure. So, as a final note, we'd like to remind everyone to continue wearing their face masks, adhere to the minimum public health standards for social distancing, and then feeding ourselves with the right information. And of course, to continue supporting the vaccination rollout, especially as we are now rolling out for the pediatric age group. So for our family members, our children, or mga nieces or nephews, we encourage that for them to be registered, so that when we get news that our second batch of vaccines arrive, they can be immediately scheduled. So thank you very much, Ma'am Myra.
Once again po, maraming salamat from Department of Health, Dr. Jemuel Cristobal. Thank you, Doc, for the update. And magkita-kita po tayo no, sa mga susunod pa po nating COVID-19 update together with Department of Health. Thank you, Doc. Okay, muli po pinapasalamatan natin ang ating panauhin at sa lahat po ng ating mga manonood ngayong araw. Maraming salamat po. Tumutok lamang po dito sa PAA Western Mindanao para po sa karagdagang impormasyon at update patungkol sa COVID-19 at sa ating vaccination program sa buong Region 9. Maraming salamat po muli. Ito si Myra Espinosa para sa Kapihan na Zamboanga. Mag-ingat po tayong lahat. Chaniki daw, ustedes.